adverse effects. A lot of books, including herbal books, mention the sunlight sensitivity, but if you actually look at the clinical trials, the sensitivity to sunlight is at or below placebo in the trials. So I would say in general, and there are a lot of trials now, it's not important. The other part is the tyramine-containing foods, chocolate, pickled fish, chocolate again. I had to mention chocolate twice. Fermented beverages, aged cheese, all those. That's for MAO inhibitors. It's not for St. John's wort. So some alternatives here. I'll mention 5-HTP and go over this a little bit, 5-hydroxytryptophan for seasonal affective disorder, which is now the same as, there are a couple other disorders they're also calling SAD. Full spectrum light, especially for SAD. Yoga and exercise, I'll mention this, and anything that de-stresses, and we'll talk about why that may be. All these might be useful for depression mechanistically. First, I want to cover 5-HTP. It's the immediate precursor for 5-hydroxytryptamine. So here is 5-HTP. Here's tryptophan. Here's 5-HTP. And it's converted next step by the decarboxylase to 5-HT, which is serotonin. So tryptophan to 5-HTP to serotonin. Note that you can give tryptophan, but you're going to get more breakdown, especially into L-kynurenine up here, and L-kynurenine has more adverse effects in general. So just be aware of that. I'm going to go back here to 5-HTP a little bit. So serotonin itself, you can't give that. It's got a lot of problems. You can give L-tryptophan. It also has more peripheral effects. 5-HTP in general is better absorbed than serotonin or L-tryptophan. It crosses the blood-brain barrier much better. It can be converted into serotonin in the nerve terminals. It actually works better with a decarboxylase, like carbidopa, and there's some research where it's been given with, co-administered with carbidopa. The adverse effects of 5-HTP include particularly GI effects, nausea and vomiting, and it is contraindicated in pregnancy, as is St. John's wort, as are all SSRIs, by the way. 5-HTP should not be taken with other drugs that increase serotonin, such as SSRIs and St. John's wort at high doses. And again, the key point here is at high doses, because we're worried about serotonin syndrome. So what is 5-HTP used for? There's not as much clinical information and clinical studies for 5-HTP. It prevents panic disorder. There's a couple studies on this. I've given the reference here. It prevented headaches after it was withdrawn from use. And it was given for obesity and actually was fairly effective for that too, interestingly. For depression, kind of a summary here. There are a lot of trials, but although only 2 of them were sufficient quality for the Cochrane group. And the available evidence suggests the substances were better than placebo at alleviating depression, but it was insufficient quality to be conclusive. That's Cochrane. Now this is the same group that said, yeah, there's plenty of evidence for St. John's wort. So not as much evidence for 5-HTP, and it's probably because just not as much research has been done on it. Doesn't mean it doesn't work, but there isn't as much evidence. This is just synthesis from tryptophan right here to serotonin, and 5-HTP is the intermediate step. So if you give tryptophan, you get more of the adverse effects and less absorption in general. So that's the key advantages here. One other point I want to make here is that here is serotonin, and we have some of the breakdown products. 5-HIAA is a breakdown. You can measure this in the urine as an example to measure how much the level or the turnover of serotonin is. Interestingly, sleep and depression are very closely tied, and serotonin is actually a precursor for making melatonin in the pineal gland. So I want to point that out also, and that if you push serotonin synthesis with 5-HTP, you may also be pushing melatonin synthesis, corrects sleep problems a little bit also. So I just want to point that out too. I also want to point out that anxiety and depression are often comorbid conditions. A fair amount of overlap here with anxiety and depression. So this is clinically significant depression. This is major depression and GAD. Also a fair amount